Namaste. This is Dr. Aparna Sreevatsa. I am a cancer specialist. I work in Shimoga for Nanjappa Hospital. So I am very happy to be meeting you all young ladies virtually today. And the topic of discussion is cancer in women. So the agenda is that we will discuss the burden of cancer, important cancers in Indian women, and how to do early detection of cancers, and what is the treatment of cancer. So why is cancer so important? When we consider all the cause of death in non-communicable diseases, the first killer is heart problems, and the second one is cancer. That's why cancer is important, and it is important to learn about cancer. So when we consider global scenario, the when we consider different countries, China has the highest number of cancer patients, followed by United States of America, and India is in third position. And it is very unfortunate that we are ranking 3 in the worldwide number of cancer patients. So when we consider the Indian scenario, um, we are finding most of our patients in last stages of cancer. It is very advanced stage of cancer. There is a delay in diagnosis of cancer. There is delay in starting treatment, and there is incomplete treatment of cancer, leading to a lot of suffering in Indian patients. So let's understand what cancer is. Cancer is any uncontrolled growth which becomes excessive, and it presents itself as a tumor. So whenever there is cell division, there is a limit to it. But when it goes uncontrolled, this uninterrupted cell division leads to an uncontrolled growth called cancer. So what causes cancer? The first one is age. As we age, our body becomes fragile, and it becomes prone for cancers. So just like buying a mixer, when we buy a mixer for a few years, say 5 years, 6 years, the mixer works very well. But with time, there is wear and tear. One or the other part gets damaged, and we have to um, get it repaired. So similarly, our body is also a machine, and with age, our body becomes susceptible to cancer. So the second thing is genetics. As we inherit property from our ancestors, we also inherit diseases. You would have seen that many diseases like breast cancer, cancer of the uterus, cancer of intestines, they run in families. So in such families, we have to be very careful and assess our risk of cancer. The third one and the most important is tobacco. Tobacco consumed in any form, let it be gutka or kaini or zarda or cigarette or BD, it is deadly, and it is a slow poison, and it kills us over a period of time. And alcohol is another bad addiction which leads to cancer of liver and also cancer of stomach and the intestines. Then very important viral infections like HIV, human immunodeficiency virus, human papillomavirus, hepatitis. So these viral infections lead to cancers. So let's see which are the important cancers in Indian women. The most common cause of cancer in Indian women is breast cancer. So let's see what are the symptoms of breast cancer. So there may be a lump in the breast. So it is a very important step to be breast aware. Are you aware of how your breast feels normally? It's very important that every month, once a month at least, while taking bath, you have to feel for your breasts and feel how your normal breast feels. That is called breast awareness. So if you feel any lump, it will be like a small swelling, it will be like a marble. So if you feel a lump, or if your nipple gets retracted, it goes inwards, or there is a change in color of your breast skin, where if it becomes very hard, or it becomes red, or it becomes tethered, then that may be a sign of breast cancer. If you are having a bloody nipple discharge, that can also be a sign of breast cancer. Or the skin over the breast, if it becomes dimpled or depressed, then so you have to periodically feel your breasts and feel how it normally feels. And if there is any deviation from normal soft breasts, you have to consult your doctor. Let it be a gynecologist or a physician, any doctor you should consult. And in the initial stages of cancer, the lump in your breast may be painless. So even if it is a painless lump, you have to worry about it and you have to go to your doctor. So in India, what is happening is, because the lump is painless, the patients ignore it for a long time, and it slowly moves on from stage 1 to stage 2, 3, and it spreads to the entire body, where we call it last stage or stage 4. So it's very important that if there is any lump in the breast, if there is any nipple change, if nipple discharge or change in the color of the skin, it's very important to consult your doctor. So what causes breast cancer? As we age, we get breast cancer. It may be you have a family history of your aunts or grandmother, or your sisters having breast cancer. That is a cause of breast cancer. And many hormonal changes, like if you attain maturity very early, like before 12 years, if you have attained menarche, or you have your first child more than 35 years of age, if you haven't breastfed your child, then that may be a cause for breast cancer. And very importantly, obesity, being overweight, can cause breast cancer. So it is very important for a woman to maintain a normal body weight throughout life. So you might have seen these young ladies, before marriage they'll be very slim and trim, but as they after their marriage, or after their childbirth, or after attaining menopause, they gain weight, and they will never be able to lose their weight. So that is a very bad sign, and obesity can cause breast cancer. So it's very important to maintain a healthy body weight. Second important cancer in women is cancer of cervix or uterus. So what is this cervix? So as we know that uterus is an organ for childbearing. So this is the uterus, and this is a cavity inside which child grows. And when it is a full term baby, in the baby comes out through the uterus. So this is the mouth of the uterus, which is called cervix. So cervix is an organ, it is the part of the uterus which is very hormone sensitive. So many hormonal changes cause cervical cancer. And the most important cause of cervical cancer is a viral infection known as human papilloma virus infection. So it is a sexually transmitted disease, and it spreads by having sexual contact with multiple men, not using condoms, and not maintaining the personal hygiene. These are all the causes of human papillomavirus infection, which leads to cancer of cervix. So what are the symptoms of cervical cancer? When should you be careful and consult your doctor? If there is any abnormal vaginal bleeding, normally we will have periods once in a month or once in 25 days, once in 4 weeks. So if there is any abnormality, irregularity in your menstrual cycles, that can be a sign of cervical cancer. If there is a vaginal discharge, if there is a white or yellowish discharge from your vagina, that may be a symptom of cervical cancer. Pain during sex or pain after having sex may be a symptom of cervical cancer, and having a low backache may be a symptom of cervical cancer. So, third important cancer in women is the cancer of oral cavity. So, as we learned that tobacco is a carcinogen, it causes cancer. So, as we chew tobacco or as we smoke tobacco, wherever tobacco flows, it can cause the cancer of oral cavity or the food tube or stomach or lungs. So it causes cancer wherever it goes. So it is a slow poison, and any form of tobacco should be, we should never indulge in tobacco chewing or tobacco smoking. So the fourth important cancer in women is cancer of the large intestine. So this is our intestine, and this is a large intestine where the fecal matter, the stools are stored here for a long time. So exposure to all the toxins in the stools causes cancer of large intestine. So what are the symptoms of intestinal cancer? If you are having constipation or diarrhea, or you are either passing many number of stools or you are not passing stools in 3-4 days, loss of appetite, fever, you are feeling that bowel is not empty, abdominal discomfort, fatigue, so blood in stools, these are all symptoms of large intestinal cancer. And what causes cancer of large intestine? Not consuming enough fruits or vegetables, indulging in junk food, and smoking, not no physical exertion. So we are dependent on machines for everything. There is mixer, there is vacuum cleaner, we have bikes, cars. So there is no physical exertion, no physical activity. So which causes obesity, and that in turn leads to cancer of the large intestine. So let us see in general what are the stages of cancer and how does cancer spread. So cancer doesn't happen in 1 or 2 days. It takes many decades for it to grow and spread. So in stage 1, it will be limited to the organ where it started. Suppose breast cancer, only you will see a lump in the breast. In stage 2, it spreads to the local lymph nodes, and in stage 3 it spreads to the local area, like if it becomes an ulcer and comes out of the skin, or it infiltrates the chest wall and rib cage, that is called stage 3. And in stage 4, through blood, the cancerous cells, they spread all over your body, like lungs, liver, brain, and that is called the terminal stage or stage 4. So we can cure diseases in early stages. We can cure stage 1 and stage 2 cancers, but stage 3 and stage 4, it becomes more and more difficult to control the cancer. So that is why it's very important to detect cancer in early stages. So what is the importance of early detection? Cancer screening is a test which helps us in detection of cancer in early stages before even signs and symptoms of cancer start. So we have these 4 important tests which can be done for early detection of cancers. One is mammography, Pap smear, and stool for occult blood, and examination of the oral cavity. So let us see each of these modalities. Mammography, any woman who is more than 40 years should undergo regular mammography tests. What is this mammography? Mammography is an X-ray of the breast. So an X-ray of the breast is taken, which can detect a slow growing or stage 0 early stage breast cancer. So every woman who is 40 years and above, even if they don't have any symptoms, they have to get this screening test to detect breast cancer. Second one is Pap smear. So as we know, from the cervix, we take scrapings from the cervix in a test called Pap smear. So any woman 30 years and above should get regular Pap smear every 3 years, which can detect cervical cancer in very early stages. So the other two tests were stool for occult blood for large intestinal cancer. After 50 years, we have to get it done. And examination of the oral cavity is for those who are chewing tobacco. They have chewed tobacco for more than 10 years. They have to get a test by their dentist or a physician to detect cancers of oral cavity. So let's see in general how treatment of cancer is provided. So the see cancer is our enemy. So we can either cut it, burn it, or poison it. So in early stages, we cut it by doing surgery, and in sometimes we give a combination. Sometimes they undergo surgery followed by burning of the cancer cells by radiation, and we poison the tumor cells by giving chemotherapy. Chemo is chemical and therapy is treatment. By giving high dose chemicals, these cancer cells can be treated and they can be killed. So this is radiation. It's a form of laser which is given to the desired tumor volume, and we control the cancer. So how can we prevent cancer? We all know that prevention is better than cure. So how do we control or how do we prevent cancer? It's very easy. You quit smoking, quit tobacco chewing, quit alcohol, or don't entertain these habits like smoking or alcohol. Then prevent obesity. So exercise is like brushing our teeth. We can't say that we don't have time. So a woman should maintain her body weight and avoid obesity in all stages of her life. Be it whether you are single or married or postmenopausal, doesn't matter. You should always, it's not only for beauty, it is also for health. By preventing obesity, we can prevent heart diseases, we can prevent cancer. And we should always have a balanced diet which is rich in fruits and vegetables. So in many of the most of the houses, it is the woman who cooks. So we should always give importance to fruit. We should have a healthy balanced diet which is rich in fruits and vegetables. We shouldn't unnecessarily use oil and lot of fats in cooking, and we should consume fruits and vegetables in abundance. And there are some vaccines for these infections, these viral infections, which are very helpful, and we can prevent cancers. Like by getting hepatitis B vaccine, we can prevent liver cancer. And usually all children, our government provides this hepatitis B vaccine for all the newborn babies, and we can prevent liver cancer. And this important other vaccine is human papilloma virus vaccine. So a child aged 14 years and above should get 3 doses. So any woman or a girl aged 14 years to 45 years should take 3 doses of vaccine, this human papilloma virus vaccine, and we can prevent cervical cancer. So what is the take home message? Cancer is curable if detected early. So our motto is to detect cancer early. And cancer can be detected early by screening tests, as we discussed, by mammography, by Pap smear, by stool for occult blood, and by oral examination. And symptoms, any symptom like a lump or a tumor, swelling anywhere in the body should not be ignored. So a woman should not only take care of her household and children and husband, but also there should be importance for self care. We should always be breast aware, and any lump, any swelling anywhere in the body, we should not ignore it, and we should take care of ourselves. And cancer can be prevented by all the measures that I discussed. So these are my cancer survivors. Can be cured, and there are multiple ways to treat cancer. Even in last stage of cancer, it can be controlled with the help of science and technology. So we should not fear cancer. We should always fight it. Thanks a lot. And if you find this information, if you find the information useful, please follow me on Instagram or Facebook on Dr. Aparna Sreevatsa, oncologist, for many more information on cancer. Thank you all, and wish you all the best in your career as well as in your life. Thank you.